Pacemakers are small electrical devices which are implanted under the skin in patients who have symptoms related to a slow heart rate or too few heartbeats at times. These devices are typically implanted under the collarbone with a small incision. There is either one or two wires implanted into the heart and then connected to the device, and everything is under the skin at the end of the procedure. Typically takes about 45 minutes to an hour. Pacemakers typically go in one of two ways, either as an inpatient in the hospital related to symptoms or as an outpatient after a slow heart rate has been identified. The typical preparation for an outpatient would be to clean off the upper body from the chin all the way to the bottom of the ribs with a special soap that we provide in our office. And this cleaning process should occur the night before. We typically ask patients to scrub that area for approximately 15 minutes in preparation for the procedure. The only other real preparation is that the patient should have nothing to eat after midnight the evening before the procedure. Pacemakers are implanted in an operating room setting under sterile technique to reduce the risk of infection. Once a patient is in the operating room, we sedate them with medications by vein, and then we clean off the shoulder, whichever shoulder we're planning on using, and cover up everything but that portion that we're going to be working on. Once the patient is sleepy and comfortable, then we make a small incision, typically 2 to 2.5 inches long, and make a small pocket under the skin to accommodate the device. Once that pocket is formed, then we get into a vein that is underneath the collarbone and use that vein as a highway to take our wires back into the heart. We can position the wires very carefully using x-rays and find a good electrical location within the heart. Once a good location is identified, we typically screw the tip of that wire into the heart itself, and then we connect those wires to the pacemaker. Once everything's connected, everything is placed within the pocket under the skin, and the skin layers are closed. Implanting a pacemaker is an invasive procedure, and it does involve a small amount of risk. There are particular things that we are worried about at the time of implant. We're always concerned about infection with any invasive procedure, and therefore patients always get antibiotics before, during, and after the procedure. In addition, the procedure is done in a sterile setting in the operating room to reduce that risk of infection. There's a risk of bleeding anytime we make any incisions on the skin. That risk of bleeding is typically rather small for these kind of procedures, as the site is quite accessible and we can always hold pressure on that location and stop any bleeding quite easily. Other risks include the risk of causing a collapse of the lung with the needle that we use to access the vein. That risk is typically 1 in 300 to 1 in 500. In addition, there is a risk of causing bleeding around the heart. In general, implanting a pacemaker is safer than many other procedures at a hospital, and the quoted mortality is typically around 1 in 25,000 patients.